Good morning, everyone, and welcome. We thank you for taking the time to be with us today. I'm Tom Sippinger, the Vice President of Clinical Sales here at CupTech. We have Gross Room Manager Andrea Alvarez with us, and she will be discussing Columbia University's implementation of the XPERT 80 system. Andrea will share why Columbia chose the XPERT 80, how they utilize this imaging solution, and the benefits of this technology that they've experienced. The presentation has been pre-recorded. If you have any questions during the presentation, please place them into the questions tab located on the right-hand side of your screen. Andrea will be here to answer any questions during the live question and answer period. At the end of the presentation, our team will share a few polling questions within the poll tab. We would greatly appreciate your feedback on the webinar. At this time, I'd like to ask Andrea to turn off her camera and place herself on mute while our presentation begins. Thank you.
Thank you. Hi, my name is Andrea Alvarez. I'm a PA at Columbia University. I've been with the hospital for 2.5 years, and I've been a gross room manager for almost a year now. I will be talking about how we implemented the CupTech XPERT 80 in our surgical pathology department. During the presentation, I will cover how we adopted the CupTech XPERT 80 into our gross room, how our facility most commonly uses the CupTech, why we chose to invest in the CupTech XPERT 80, some direct benefits that we've seen, and a brief video demonstration on how to use the CupTech. CupTech in surgical pathology has made huge improvements on our team. First, we will focus on patient care. With patient care, it has improved due to precise sampling of surgical specimens. We are able to utilize the CupTech and choose what areas we would like to sample. With workflow management, the PAs no longer have to spend time going to mammography or radiology to x-ray a specimen. This allows the PAs to focus on grossing the specimen as opposed to traveling to different departments to x-ray their image. With that, turnaround time has improved. It has allowed for the PAs to sample the specimen appropriately on initial sampling and prevent the request for additional sections from the attendings. If an attending chooses to add additional sections to a specimen, it delays the turnaround time as it requires for a PA to locate the specimen, take the additional sections, and then once the sections have been acquired, the histologist will have to embed, stain, in case they're special stains. All of this adds to the overall turnaround time. With the request of additional sections, we are no longer being efficient with our resources. This requires extra time from the PAs, pathologists, and the histologists. There are many uses of the CupTech XPERT 80. Breast, paraffin-embedded blocks, and fetal demises are the 3 most common uses we use the CupTech XPERT 80 at Columbia. With breast, lumpectomies and mastectomies are the bulk of what we x-ray. We are looking for biopsy clip and calcification in these instances. Paraffin-embedded blocks are also used to determine whether the clips or calcifications have been submitted in these blocks. We use the XPERT 80 with fetal demises. We try to rule in or rule out musculoskeletal diseases when the clinical history correlates. With bone resections, we typically will x-ray the bone resection to identify the presence or the absence of the hardware. You don't want to section through a bone resection for osteosarcoma and dull your bone saw blade due to a rod or a screw. With the XPERT 80, the x-ray helps prevent that. We also use it to determine the degree of calcification. So prior to using EDTA or decalstat, we will take our section, x-ray the block with the bone section, decal it, and periodically x-ray the section to determine if it's fully decalcified. Using the XPERT 80 for organs can also be helpful to determine whether staples, vascular clips, calcifications within a vessel is also present.
See that right?
In this instance, we have a gross image of a lumpectomy that has been serially sectioned. These sections are approximately 0.4 centimeters thick, and it's highly composed of adipose tissue. So on gross exam, a definitive lesion is not present. The clinical history correlating to this specimen is of a woman with one biopsy clip that correlates to ALH, which is atypical lobular hyperplasia. As many of us know, ALH does not present as a definitive lesion. It's pretty scattered and very ill-defined. Because of this, we will then resort to the CupTech XPERT 80. Here we have an X-ray image of the lumpectomy that we previously saw. We can tell that there is a barbell biopsy clip located in slice number 7. Grossly, we would have never correlated this slice with the lesional tissue, as it is embedded in normally appearing adipose tissue. Another common specimen we use at XPERT 80 is mastectomies. So in this instance, we have a simple mastectomy that was previously prepped over the weekend. On Monday morning, the PA gets it, and on initial sectioning, the mass was palpated, but a biopsy clip was not identified. In this instance, we found the mass, but there's actually 2 biopsy clips, one correlating to invasive ductal and one correlating to DCIS. So the one that we have highlighted with the red arrow is where the mass is present. However, we can't grossly identify that clip. Thus, we go to the CupTech XPERT 80. In here, you'll see that we have the gross image with the red arrow on the far left showing the mass. In the middle, we have a transition between a gross image and the X-ray, and highlighted with the red squares are the 2 biopsy clips. A little hard to see, but if we look at the right image, we see that both biopsy clips are present, the one that's within the mass and the one that correlates to DCIS. So here we have taken a specimen that looks a little bit daunting, and with the use of the CupTech, we have minimized that effort and found both biopsy clips so that we could properly sample the specimen. Another use for the CupTech XPERT 80 is paraffin embedded blocks. We use the CupTech XPERT 80 to identify calcifications on biopsy resections. So if a patient goes into mammography and they identify calcifications, it will usually prompt the clinical team to extract a biopsy. The biopsy can be targeted either using stereotactic or ultrasound guided. This is done either using X-ray or ultrasound. So in this instance, we try to locate the calcification in the paraffin embedded block to prove that there really is calcifications in the specimen that they retrieved. And in this instance, we can see the top image shows the 3 cassettes associated with the biopsies. In red, I have circled the microcalcifications. They're very hard to see. So once we have identified the calcifications, we put the cassettes on edge, and we identify where the calcifications are. So in the bottom image in red and blue, we can see that those calcifications are embedded within that paraffin. This information is utilized by histology so that they know how far they have to face into the block. Then they can appropriately cut a section with the calcification. The attending can then confirm the presence or the absence of the calcification on the slide. We also use it to X-ray paraffin embedded blocks to locate the biopsy clip site. So in the top image, we see that this is an intact lumpectomy, and we can locate that there is a hook biopsy clip in the center. On initial sampling, the specimen was serially sectioned, and the biopsy clip was embedded in one of the slices. Instead of trying to thin out that slice, what we do is we submit it as is, and we just X-ray the blocks. That way we know that the biopsy clip is in part in slide 3, and in our cassette summary, we can indicate that to the pathologist. That way they can evaluate the biopsy cavity site. Another instance when we would X-ray paraffin embedded blocks is if we are seeking the location of a biopsy clip. Many times the surgeons want the pathology team to confirm the presence or absence of a biopsy clip. In this case, we see the whole specimen at the top, and there is a biopsy clip centrally located. When we serially section the specimen, we have a section where the biopsy clip is actually embedded within that slice. So instead of thinning out the slice and distorting the biopsy clip site, we submit it as is. Then we x-ray the sections and we identify in what cassette the biopsy is located. We can see in the bottom image that the biopsy clip is present in cassette 3. This allows for the attending to view the slide with the biopsy cavity site. We also use the CubTech XPERT 80 with fetal demises. It has become a common practice for us for postmortem examinations to use the CubTech XPERT 80 to rule in or rule out musculoskeletal diseases. The most common consist of achondroplasia, Duchenne muscular dystrophy, and osteogenesis imperfecta. Helpful imaging helps identify the radiodensity, skeletal morphology of specific bones, and with this information, the neonatal pathologist can evaluate whether a fetus was afflicted with a musculoskeletal disease. In this case, we can determine whether the bones are similar or vastly different and if it correlates to a specific musculoskeletal disease. There are many reasons why Columbia invested in the CubTech XPERT 80. An increase in volume was the predominant reason why we decided to acquire the CubTech. With 5 full-time breast surgeons practicing at 2 different locations, it amounts to a lot of breast specimens. Overall, we receive approximately 50,000 surgical specimens in 2021, but that ranges anywhere from 50 to 60,000 cases a year. Of the 50,000 cases, 710 of them were strictly breast resections. This is limited to lumpectomies and mastectomies, so many uses for the CubTech XPERT 80. The 710 breast cases does not include sentinel lymph nodes, breast reductions, or axillary contents, which are other specimens that we can use the CubTech XPERT 80 for. Utilizing our PA staff to their full potential was another reason why we decided to invest in the CubTech XPERT 80. Coordinating with mammography was very time-consuming. Mammography sees so many patients a day, they're such a busy service, that us trying to get squeezed in between patients was just a lot of work. So time is of the essence for the PAs. For us to get to mammography from the gross room takes 9 minutes, and that's if you're catching the elevators on a good day. Once you get to mammography, it takes another 15 minutes to x-ray the specimen and print films. Another 9-minute walk back, and a total of a minimum 33 minutes a PA is out of the gross room and not sectioning a specimen. So definitely does not allow for a productive PA. Compare this to the CubTech XPERT 80. It takes about 2 minutes to input the patient information and another 2 minutes to acquire the image. So substantial difference. Some direct benefits that we've seen due to the CubTech XPERT 80 is a huge reduction of blocks. I acquired data from 20 lumpectomies and 20 mastectomies prior and after the acquisition of the CubTech XPERT 80. So in 2021, the total number of blocks sampled for the 20 lumpectomies was 322 blocks and 559 blocks for the 20 mastectomies, totaling to 881 blocks. After the acquisition of the CubTech XPERT 80, the number of blocks for 20 lumpectomies was 263 and 394 for 20 mastectomies, total 651. It's pretty evident to see that there's a reduction in blocks. The numbers tell it all. A reduction in block submission from 2021 to 2022 for lumpectomies and mastectomies, from 16 to 13 blocks for the lumpectomies, 28 to 20 blocks. Seems like not a lot, but when we look at the percentages, the lumpectomies, there was almost a 19% decrease in block submission and roughly 29% decrease in mastectomies. With a reduced number of blocks means reduced number of time. So one cassette amounts to approximately 5 minutes of a histologist time. So this includes embedding the block, cutting the block, staining. So overall, it takes about 5 minutes of a histologist time. Once that slide is ready, it takes another 1 to 2 minutes of a pathologist time to actually review the slide. So less blocks, more efficient. And the less blocks we have, there's also a decrease in need for storage. So here in New York City, we're just really tight on space. So the less that we have to archive with blocks and slides, the better for us. Next will be a video demonstration of the CupTech XPERT 80. So this is our video demonstration about the CupTech XPERT 80. One thing that you'll notice is that our CupTech is actually a tabletop version. CupTech was able to work with us and create a stationary version of the XPERT 80. For us, we're just kind of tight here in New York City with space. We had the counter space already, we just had to clear it, and it was better for us to keep it in this version versus the stackable configuration on wheels. It's a very user-friendly, very quick to learn. We actually had a sales rep and a technician on site with us to help us train, and they spent 10 to 15 minutes one-on-one with each of our PA. It was a painstaking training process because she had to repeat herself, but she was very patient with us and took the time just to demonstrate how easy it is for us to learn it. So the XPERT 80 has a chamber here, which is where the specimen goes. There's a grid on the center of the device that allows you to x-ray everything that's within that plane. If you have a smaller specimen, the XPERT 80 did a magnifying tray, which allows us to magnify 2, 3, and 4 times. So what you'll do is you'll automatically just place your specimen on the magnifying tray and allow it to be closer to the detector and take your image. As far as the input for the information and obtaining an x-ray, it's quite simple. You go to the monitor and you first set up a new patient. You type in their medical record number, name, gender, date of birth. If I wanted to acquire an image, I would also put the accession number. So here our main system is SP for surgical pathology, the year, and the case numbers. After that, you just hit the Acquire 2D button. Once you have acquired your image, it'll take about 2 minutes. It'll simultaneously bring an image of your specimen and an x-ray image of the specimen as well. So in this case, we can see that there is a Savvy Scout present in the center of the surgical resection. To magnify, you can choose an icon at the bottom called magnifier, and it allows you to just toggle over your specimen and magnify at any magnification, 3, 4, and 5 times. Another important tool that we commonly use is the blender tool. The blender tool is unique to the CupTech company, and it's probably the most beneficial tool that we use. So what I do first is I typically will zoom in on the specimen, and then you toggle down here between an x-ray and more of the optical image. So here we just see pretty much a gross image of our specimen. If we go to the far right, we'll see exactly the gross image, and if we start decreasing to the left, we'll see more of an x-ray. So right here, we're right at a transitional period where we can still see some color, but we can also see the x-ray biopsy clip. So if we go all the way to a black and white radiology image with the Savvy Scout quite predominant. Other tools that we use are the ruler tools, so we can measure how far the clip is to a certain edge. In this case, I'm just going to measure to our identifying stitch. From the biopsy site to the stitch is 1.8 centimeters. It's actually written in millimeters, so 18.6 millimeters or
us, for our gross descriptions, we keep everything in centimeters, so 1.8. Other tools, you can annotate your specimen, so left, right, superior, inferior. These are just inputs that you can put to help annotate your image and provide further clarification if a radiologist or pathologist were to look at the image. And that's our video presentation.
Thank you so much for your time.
Thank you, Andrea, for a very informative discussion of specimen imaging in the gross room. We appreciate your sharing your experience and expertise with us. We are grateful. We do have some questions, so if you wouldn't mind turning your microphone and camera back on. Thank you. So the first is, what is the learning curve like for a PA with very little to no X-ray experience?
It was quite simple, just because the XPERT 80 does take a gross image already of your specimen. To transition from a gross image to an X-ray image and do it so seamlessly with that blender function was quite simple. Like I had mentioned in the video presentation, we had a service tech actually come in, and she trained each one of us for like 5 to 10 minutes, and that was all it really took. And we didn't have a faxitron, we didn't have any type of imaging device prior to the cup tech, so we just would go to mammography, have a print film, and then try to utilize that print to our raw specimen. So the learning curve was quite easy for us.
Great, thank you. That's a good segue into the next question, which was, how do you use the image blender feature?
Yeah, so the image blender feature is more helpful than just an X-ray image, just because you can pinpoint like just even curvatures of a slice to try to identify where the mass is at. It's definitely very helpful in a mastectomy that has been treated already, or a mastectomy that is prophylactic and you're maybe suspecting that there could be some DCIS. So you're trying to locate focal areas where there might be some calcifications, but on a raw specimen, the gross image doesn't allow that. So if you take and toggle the specimen at the bottom and move it closer to the X-ray image, it allows you to kind of like utilize it in that sense. Yeah, so it's a very helpful tool, definitely the one we commonly use.
Wonderful, thank you very much. We do have a couple of additional questions. Our department had a budget request rejected this year. How would you suggest that we prove our case for clinical need for specimen imaging?
I would just kind of look at how many blocks there are. I feel like overall we have shortages in histologists and PAs that justifying the amount of cost that it's going to be to purchase a cup tech, as opposed to how much cost we're going to save by reducing the number of sections, is important. And I feel like numbers always speak louder for departments. So that was definitely a big part for us. And then we just had acquired our fifth breast surgeon. So we knew the volume was only going to increase for us. So if you have something similar to that, I think those are great talking points to try to persuade your department to budget for an imaging device.
Yeah, it's a really interesting question. I think that's one that we hear fairly often, and we appreciate your sharing those thoughts on how to get the equipment you need. I have one final question that I've received. Do you send images to your LIS?
So We actually did not purchase that function to send images to our LAS. However, we were able to work with our IT department, and our attendings actually remote into the monitor. It's not the most efficient way. It would be wonderful to just have it pop up in our LAS. However, it is the way we've kind of worked around it. If that's something like budget-wise was also something we had to consider. So we kind of figured it out that way for us.
Great. I think we got one more question here and I'm trying to find it. I've lost it somehow. There they are. Okay. Can we get access to the video? It will help with our potential donor. I think that's a question. Yeah, I think that's probably a CubTech question. I think we will absolutely make that video available. Well, it'll be on our website, and if I can't see from whom that question came from, but if you'll send your email address to us at I believe it should be sales@cubtech.com. We can get a link to that video for you. I have one more, I think, here. How many images may be stored? I'm not sure, Andrea, if you can you answer that?
I'm not entirely sure, but that was something we were wondering as well, since most of our images are stored within the hard drive as opposed to sending it to our LAS. But we were told, because that was one of our concerns as well, that we would go 10 years without even tapping into the full capacity of the memory for the CubTech. But I believe they're making, at least we were told, that coming this summer, there's going to be a way to export the images to a thumb drive. I'm not sure where they're at with that, but that would be another way to kind of increase your storage.
Yeah, I can actually, from personal experience, answer that question as well. Yeah, I would say over 10 years it'd be almost impossible to fill up the hard drive on the system, but there is access to a USB drive where you can just put a thumb drive in and download your images to an external device. Absolutely. I think that's it. I think that's the last of the questions. So, Andrea, we really appreciate all of your time today. You're a wonderful resource for this group, and we appreciate the time you've spent with us.
Well, thank you for having me.
And to everyone who joined us this morning, we very much appreciate it. And I know that this presentation, this webinar will be available on our website, and we wish you all a wonderful weekend. Thank you.
Thank you. Take care.
Thank you.